This presentation is on Q fever by Gurpreet Virdi. The Q in Q fever stands for curry because initially Q fever's pathology was unknown. Q fever is a disease caused by the bacteria Coxiella burnetii. Coxiella burnetii is a pathogen that infects both animals and humans. Coxiella burnetii commonly infect cattle, sheep, and goats. They can be found in placenta, embryonic fluid, urine, feces, and milk of infected animals. Coxiella burnetii infects people when they breathe in dust that contains contaminated particles of the infected animals. Another means of transmission for humans is eating contaminated, unpasteurized dairy products. However, it is not necessarily spread via direct contact with an animal. Q fever rarely spreads via sex, blood transfusion, and from a pregnant woman to fetus. Those who are at higher risk of contracting Q fever are veterinarians and farmers. Q fever first began to be known as a human disease in 1935 in Australia. It first appeared in the United States in the 1940s. In 1999, it was made a notifiable disease in the United States. Q fever cases reported by the states and local health departments are compiled by the Centers of Disease Control and Prevention, also known as CDC. CDC then reports the national trends of these cases. The top figure, Figure 1, shows the number of United States Q fever cases that were reported to CDC between 2000 and 2014. Looking at this figure, the number of cases reported to the CDC has increased between 2000 and 2007. However, between 2008 and 2013, the number slightly decreased, but then rise in 2014. From the 160 cases of Q fever reported in 2014, 137 were acute Q fever and 39 were chronic Q fever. Generally, 75 to 90% of cases reported are acute Q fever cases. Yet, a Q fever infection, especially chronic Q fever, can lead to severe complications that may require a person to be hospitalized. These severe complications include endocarditis, encephalitis, pneumonia, hepatitis, and splenomegaly. The bottom figure, Figure 2, shows the hospitalization rates in the United States of Q fever cases reported to CDC between 2002 and 2014. Looking at this figure, over 50% of cases between 2002 and 2014 required hospitalization for Q fever. The signs and symptoms of Q fever range from mild to severe. It is estimated that 5 out of 10 people who are infected by Coxiella burnetii will get sick, and less than 5 out of 100 will develop a severe infection called chronic Q fever. It typically takes 2 to 3 weeks for the illness to develop after being exposed to the bacteria. People can develop flu-like symptoms such as fever, chills, fatigue, and muscle ache. Other symptoms are nausea, vomiting, diarrhea, chest pain, abdominal pain, shortness of breath, among others. People with chronic Q fever can develop pneumonia, hepatitis, pericarditis, and endocarditis. If left untreated, it can be deadly. Diagnosis of Q fever can be difficult since the symptoms are very similar to other diseases. However, there are serology tests available that can help diagnose Q fever, such as enzyme-linked immunosorbent assay, immunofluorescence assay, complement fixation, and microagglutination. Antibiotics such as doxycycline, quinolone, and erythromycin are used to treat acute Q fever disease. The duration of these antibiotics is 2 to 3 weeks. Antibiotics such as rifampin and tetracycline are used to treat chronic Q fever. The duration of these antibiotics is at least 3 years. Although a vaccine against Q fever is not available in the United States, precautions can be taken to prevent the disease. Precautions such as controlling dust contamination, not consuming raw dairy products, and avoiding contact with animals, particularly when they are giving birth. Make sure to dispose of breast fluids and other organs properly. Coxiella burnetii can be used for a potential biological attack or bioterrorism. A biological attack or bioterrorism is the intentional release of bacteria, viruses, or other germs that are intended to sicken or kill people, livestock, or crops. Coxiella burnetii is known as a highly infectious agent, where less than 10 bacteria can cause a person to become sick. It is extremely resistant to heat, drying, and many common disinfectants. Its easy transmission via inhalation makes it a good bacterium to use for a biological attack. Therefore, it has been closely monitored by many federal agencies. An interesting fact about Coxiella burnetii is that it has been previously weaponized for use in biological warfare. The following are the references I used. Hope you enjoyed the presentation.